Menopause signals the conclusion of a woman's reproductive phase, representing a natural progression encompassing hormonal and physiological shifts. Having an understanding of what to anticipate can streamline the transition. The experience of menopause is unique for each individual. It might pose challenges for some, particularly if hormonal changes manifest in symptoms like hot flashes and anxiety. Conversely, others view it as a liberating period, freeing them from concerns about menstruation and birth control. Here are 10 essential menopause facts to help a person better understand the process. Menopause is a gradual transition. Most individuals don't experience menopause abruptly. It's a gradual process rather than a distinct moment. In a person's 30s or 40s, the levels of estrogen and progesterone start decreasing, marking the onset of perimenopause. During this phase, menstrual cycles may become irregular until they eventually cease. Menopause typically commences 12 months after the last period, usually occurring between the ages of 40 and 58, with an average age of 51, as stated by the North American Menopause Society. Hot flashes, a common symptom, typically last between 6 months and 2 years, but can persist for a decade or more. Surgical removal of ovaries induces immediate menopause, a topic further explained in surgical menopause discussions. Certain medical treatments, like chemotherapy, may trigger menopause, and while this can be temporary, menstruation may resume post-treatment. Additionally, specific medical conditions can lead to an earlier onset of menopause. Perimenopause can start in early 30s. Perimenopause, the phase preceding menopause, spans a duration of 4 to 8 years. In this period, there is a gradual decline in estrogen and progesterone levels. Menstrual cycles become less predictable and signs of menopause may emerge. These signs encompass hot flashes and night sweats, vaginal dryness. Individuals experiencing concerns about these symptoms should consult a doctor to rule out potential health conditions such as an overactive thyroid. In one's 40s, a missed period may indicate either pregnancy or the onset of menopause. Common symptoms. Menopause is not a medical condition, yet the hormonal shifts it brings about can trigger various symptoms. These symptoms can vary from mild to severe, causing discomfort and distress in some instances. Treatment options are available to help manage these symptoms. Common symptoms include hot flashes, sudden sensations of heat in the upper body, affecting up to 75% of individuals. Night sweats, hot flashes that occur during the night, difficulty sleeping. Challenges in sleeping may arise due to night sweats, mood changes, and anxiety. Vaginal dryness. This can lead to pain during sexual activity. Reduced libido. Decreased sexual desire can result from declining hormone levels, and vaginal dryness may also make sexual activity uncomfortable. Mood changes. Fluctuations in hormone levels and environmental factors may contribute to stress, anxiety, and depression. Osteoporosis. Hormonal changes linked to menopause can also contribute to osteoporosis, a condition where bone density decreases, increasing the risk of fractures. The likelihood of osteoporosis rises during and after the menopausal period. Menopause and sex. Some individuals worry that menopause might diminish their attractiveness or hinder their ability to enjoy a satisfying sex life. However, it can bring a fresh perspective to sexuality, freeing individuals from concerns about menstruation and pregnancy. Tips for maintaining an active sex life include consulting a healthcare provider about lubricants and other methods to alleviate vaginal dryness, engaging in regular exercise and adopting a healthy diet to keep the body fit, spending intimate time together in non-sexual ways like having a regular date night, exploring new forms of arousal with a partner. Partners may also grapple with uncertainties about sex during this phase. Open communication is key to helping both individuals overcome any barriers. For those who are single, options such as joining a local club, participating in singles holidays, or using a dating site may be considered. It is still possible to get pregnant. Menopause signifies the conclusion of a woman's reproductive phase, yet the possibility of becoming pregnant persists around or after this time. Perimenopause, which can initiate 4 to 8 years before menopause, still allows for pregnancy as long as menstruation continues. However, the likelihood of conceiving and having a full-term pregnancy decreases as one approaches menopause. Advancements in reproductive technology have made it feasible to conceive after menopause, typically involving donated eggs or embryos preserved earlier in life. There might be an elevated risk of pregnancy loss, preterm birth, and potential health risks for the woman, depending on her age and health status at the time of conception. It's worth noting that younger individuals who haven't entered menopause may also encounter similar issues, as emphasized by an expert in the field. The body continues to generate hormones. After menopause, the body continues to produce estrogen, albeit in smaller quantities. Estrogen is crucial for several vital functions, and the body still requires some amount of it. Nevertheless, post-menopause, the ovaries no longer produce estrogen. Instead, the adrenal glands generate hormones known as androgens, and another hormone called aromatase transforms them into estrogen. Menopause and weight gain. Many individuals undergo some weight gain during menopause, but those who were not overweight prior to entering this stage can typically address it through lifestyle adjustments. On average, many people gain around 5 pounds after menopause. Potential reasons for weight gain include increased hunger due to changes in hunger-controlling hormones, metabolic changes influenced by hormonal factors, less healthy eating habits, reduced physical activity. For those concerned about weight gain, consulting with a dietitian or doctor for suitable options, likely involving dietary and exercise choices, is recommended. Maintaining a healthy weight can contribute to a reduced risk of various long-term health issues. Individuals with obesity before or during menopause are more likely to experience symptoms like hot flashes. Weight loss can be beneficial in managing some of these challenges. Menopause and stress. Many individuals report difficulty concentrating and remembering things during menopause, often referred to as brain fog. Stress plays a significant role in these cognitive challenges. Factors contributing to stress may involve the impact of physical changes, pressures from domestic, professional, and other aspects of life. Concerns about the aging process. Effective strategies for managing stress and addressing cognitive difficulties include regular exercise, participation in relaxation or yoga classes, keeping a visible calendar with upcoming events, striving to balance responsibilities and personal interests, maintaining connections with friends and family, engaging with others experiencing menopause, seeking help if there are concerns about memory loss, anxiety, or depression. Treatment. If symptoms significantly affect a person's daily life, a doctor can recommend medications. Hormone treatment. This approach can address many issues by balancing hormones. However, it may not be suitable for those at risk of blood clots, stroke, breast cancer, dementia, or gallbladder disease. A doctor can provide guidance on suitable options. Antidepressants. Low doses of paroxetine may be effective in treating hot flashes. Sexual well-being. Lubricants can help with vaginal dryness. If these, along with natural remedies, prove ineffective, a doctor may prescribe vaginal hormones in the form of a ring, cream, or tablet applied directly to the vagina. Preventing osteoporosis. Regular bone density assessments may be suggested to monitor bone strength. If the results indicate weakening bones, the doctor may prescribe vitamin D supplements and offer diet and exercise recommendations to reduce the risk of osteoporosis. Mood changes, anxiety, and depression. Hormone treatment may be beneficial, or a doctor can prescribe medication. Counseling and relaxation techniques can assist in managing stress and depression, and some individuals find aromatherapy helpful. Sleep problems. Various factors can contribute to sleep problems during this period. Ensuring sufficient exercise, limiting coffee intake, and maintaining a healthy sleep routine are recommended strategies. Menopause is a new beginning. Menopause impacts an individual's health and overall state of being, but it's important to note that it is not a disease. Experiencing menopause doesn't signify that the body is failing or that the person is growing old. The hormonal changes leading up to menopause commence in a person's 30s or 40s. In 2017, the average 50-year-old woman could anticipate living to at least 83 years, revealing that perimenopause initiates less than halfway through the average lifespan. As societal perspectives on aging shift and life expectancy increases, people are starting to view menopause as a fresh beginning rather than a conclusion.